Hello everyone. Welcome to today's live presentation. I welcome all my viewers on LinkedIn, Facebook as well as on YouTube. Today I am going to speak on a very interesting topic. I am going to discuss about immunological investigations. Now, many a times our friends, doctor friends, IVF specialist friends ask us about immunological investigations. And so today's my topic is decoding immunological investigations in unexplained reproductive failure. I am Dr. Mohan Raut. I am a gynecologist and clinical reproductive immunologist certified by the American Society of Reproductive Immunology. And we have our center, Dr. Raut's Center for Reproductive Immunology, and we have 8 centers across India where we treat couples with unexplained repeated miscarriages, recurrent IVF failures, unexplained infertility using our patented and branded process of Immulet and other immunomodulatory medications. So, coming to today's topic, about decoding immunological investigations. To understand more about immunological investigations, I think it is very important to know the basics about the immunology and role that immune system plays in pregnancy. So I am briefly going to discuss that part so that we can turn to the investigation and correlate the basic immunological problem to the investigations. Now, before I start, I would like to clarify that I will be talking about the allo-immune part of immunity, or the immunity which pertains to pregnancy and how it impacts the success of pregnancy. So, if we consider the importance of immune system in pregnancy, all of you know that our body has a protective system, immune system, right? And its function is to protect us from anything that comes in our body from outside that is foreign, different to our body, because that may be potentially harmful to us, like bacteria, viruses, harmful chemicals. So our body doesn't accept anything that is foreign and it builds a reaction against it to destroy it or to reject it so that we are protected. Now, and this happens with the help of immune system. Now, on this background, if we see a pregnancy, see, every pregnancy is 50% from mother and 50% from the father, usually. If we use a donor egg in IVF, then it is 100% different. But in spite of that, usually pregnancy grows without any problem. Why? Because pregnancy has a special immunological protection. And this protection is with the help of certain type of protective antibodies called as the blocking antibodies or asymmetric antibodies, and certain type of protective cells called T regulatory cells. And these are the two mechanisms that protect the pregnancy in spite of it being different from mother's body, because it is genetically different, immunologically different. So, usually this protection is in place, but in some cases, this natural protection doesn't function properly. There is no reason why, but the effect is either the protective antibodies are not formed at all or they are very low, protective cells are low. So what happens is, as soon as there is pregnancy, an immunological reaction starts because there is no protection to the pregnancy that naturally otherwise is there. And when the reaction, this immunological reaction becomes maximum, growth of the pregnancy stops. Now, depending on at what stage of pregnancy this reaction will become high, we can see different presentations. Like suppose this reaction gets delayed, then the pregnancy test is positive, sonography will show pregnancy, even heartbeats are seen and they suddenly disappear, causing a miscarriage. If this happens little early, only sac is seen, no pregnancy inside, resulting in what is called as a blighted ovum, type of again missed abortion. If this is little early, then just beta HCG comes positive. No, so nothing is seen on sonography, what is called as a biochemical pregnancy. If this reaction occurs very early, that is, you know that from the time of conception, by the time we come to know that there is pregnancy, it takes around 14-15 days. So suppose after conception, say this reaction occurs in 2-3 days and the growth stops, then we won't know also that there was pregnancy, because either the periods will come on time or the beta HCG will be negative. And this last scenario is more relevant in IVF, because in IVF we know that for sure that we are putting in live pregnancy inside, live embryos inside, and end of it, if we get negative result, that is if IVF fails, that also can be because of immunological reaction against pregnancy. So all these problems, IVF failure, IUI failure, uh, biochemical pregnancy, miscarriages, and even plain unexplained infertility can be because of this immunological reaction to pregnancy. Okay, so these are the conditions where we apparently don't know why they are occurring, especially if all other factors are normal. And it is in these cases that the problem is more likely related to the mother's immune system, or what we call as allo-immune problem. So you will must have understood now in which cases we will require immunological investigations. These are the cases: unexplained infertility, unexplained IVF failures, unexplained miscarriages. And one more extension of this is little late onset pregnancy losses like early onset preeclampsia and IUFDs, and certain late pregnancy losses even later in later second trimester and third trimester also. So with this background, if we now have patients who have these unexplained reproductive failures, how do we approach these patients? Which investigations we do? Let's come to that part, our core part of today's talk. Now, one very important thing before doing these immunological investigations is we must rule out all other known factors responsible for these reproductive failures. So, for miscarriages, all factors related to possible causes of miscarriage must be done and ruled out. So, also for IVF failures or implantation failures. And along with that, then we come to the allo-immune investigations. Now, there is a big list of investigations, but there are certain investigations which we do at our centers and which help us to take action on or accordingly treat these patients. So I am going to stress on those specific practical investigations. Now, the first investigation that is done in these cases to know about alloimmune problem is what is called as lymphocyte antibody detection test, or LAD test, which in India we do as lymphocyte cross match test, because we don't have dedicated reproductive immunology labs in India. So this test, this lymphocyte cross match, which is a similar test, is done at the transplant immunology labs, and we get this test done as lymphocyte cross match in transplant immunology labs. This LAD test basically, it detects the presence of blocking antibodies or protective antibodies, because when we discuss about the immunological part, the basics of immunology, the protection of pregnancy is with the help of blocking antibodies and the protective cells or T regulatory cells. So naturally, the first test that will tell us about the protection, whether the protection is there or not, is the lymphocyte antibody detection test. And a positive lymphocyte antibody detection test means that these protective antibodies are already there, or the cross match which is positive, they are already there. And in such cases, the meaning of this is the immunological protection is already in place, and in spite of that, the pregnancy reproductive failures are continuing, then the problem may not be immunological at all, because the protection is there, still pregnancy is not continuing or pregnancy is failing. But if the LAD test is negative, then it definitely indicates there is lack of protective antibodies, either they are not, or they are not there, or they are very low. And this is the couple, or these are the couples with negative LAD test or cross match test who are benefited by the lymphocyte, by the immunological treatment, which in the form of Immulit, what we give, which I will briefly mention at the end of all the investigations. The treatment that will help produce these antibodies will become beneficial. Now, here it is very important to know that the lymphocyte cross match test that we do here is basically, here it is done for transplant patients. Okay, and for a transplant to be successful, this lymphocyte cross match has to be negative. If it is negative, then the transplant is accepted. But for reproductive immunology purpose, when the LAD test is done, a negative LAD indicates that a treatment will be required, and the positive LAD means protective antibodies are already present. So if we have only cross match lymphocyte cross match as a test that is there with us, then if the cross match is positive, then we have to distinguish these antibodies into two types, whether they are the real blocking antibodies or the anti-HLA antibodies, which are not the good antibodies. And of that distinction, we will make it clear whether these protective antibodies are definitely there. But if it is negative, definitely it means that these protective antibodies are not there. So we would stress on LAD test as the first important test that will help to know about the allo-immune problem. The second test that we recommend is the natural killer cell test. Now, what are these natural killer tests? These are the tests, these are the cells, type of white blood cells, and they are part of immune system. And we can estimate these cells, especially the CD16 plus 56, the conventional NK cells, which are important for implantation and early growth of pregnancy. So, in peripheral blood, if their count is very low or if it is very high, both these extremes is not good for pregnancy, indicating an immunological imbalance. So, along with peripheral blood NK cells, even endometrial natural killer cells can be done, though it requires a procedure like a DNC. But this procedure can estimate whether there are excessive CD16 plus 6 CD56 type of cells in the endometrium, or if there are CD57 type of cells in the endometrium which normally should not be there. So endometrial biopsy done in luteal phase and the endometrium sent in formalin for immunohistochemistry for CD57 helps to detect these cells, and their presence indicates an allo-immune problem and where immunological treatment becomes beneficial. So this is about natural killer cells. The third test is related to the cytokines or the chemicals produced by these white blood cells. So we at our centers do TNF alpha estimation, tumor necrosis factor alpha estimation, which is a destructive or inflammatory cytokine, and high levels of TNF alpha without any apparent reason are associated with reproductive failures, miscarriages, IVF failures. So if the TNF alpha is high, then that is an indication of immunological imbalance, and such patients will be benefited by the immunological treatment. Here, there is an option of doing Th1, Th2 cytokines, which shows if the Th1 the type of cytokines are high, the ratio is high, and TNF alpha is a Th1 type of cytokine. So that also indicates an inflammatory environment and indicating immunological problem. Now, here one important interpretation of all these three tests together, I would like to tell, which is not mentioned anywhere. Otherwise, that the basic problem in these immunological reproductive failures is lack of protection. So the protection to the pregnancy is not there. The protective antibodies are not there. So because of that, the pregnancy is attacked by the immune system. So that leads to changes in natural killer cells and changes in the cytokine, that is TNF alpha. So many of the times, increased TNF alpha and abnormal natural killer cells are the effect of immunological imbalance and lack of immunological protection, like a patient who has typhoid gets fever. So if you treat only fever, then the fever will come up again because you haven't treated typhoid. Similarly, patients who have immunological imbalance or lack of protection will have immunological imbalance, will have excessive TNF alpha, abnormal NK cells, but they are the effect of lack of protection. So if we just treat these parameters by medications, they will come up again because we have not treated the basic problem of immunological lack of immunological protection. So it is very important that these three tests should be considered together to interpret their significance, and if they indicate, then immunological treatment can be implemented in these patients in the form of active immunomodulation. Along with that, the two more tests we recommend, which also help in planning the immunological treatment at our centers, and that is anti-thyroid antibodies. Now you will say anti-thyroid antibodies are autoantibodies. So how they are related to the allo-immune part of the problem? So it is very interesting to know that antithyroid antibodies have structure similar to the asymmetric antibodies or blocking antibodies or protective antibodies. So what happens is if the protective antibodies are very low and these antithyroid antibodies are high, they selectively affect pregnancy, causing reproductive failures. It is now known that antithyroid antibodies, anti-TPO and anti-thyroglobulin have adverse effect on pregnancy, leading to miscarriages, implantation failures. So if the protective antibodies or blocking antibodies are high or we make their level very high, then what they do is they competitively inhibit the antithyroid antibodies and prevent their impact or adverse effect on pregnancy. So this competitive inhibition can be achieved by giving a treatment that will increase the protective antibodies like the Immulit or lymphocyte immunization therapy, and then that treatment will help increasing the protective antibodies which will displace the antithyroid antibodies. So this is a unique mechanism which helps prevent the adverse effect of antithyroid antibodies on pregnancy and thus protecting the pregnancy, which otherwise these antithyroid antibodies have no treatment. The thyroxine or steroid which are given, they usually don't have any impact. And for this treatment, the Immunology treatment to be successful in this, we don't require to bring antithyroid antibodies down. They just competitively inhibit these antibodies, leading to success of pregnancy. So it is very important that these antithyroid antibodies should be checked in these couples who have recurrent reproductive failures. So these are the main 5 investigations that we use to select couples, or rather to find out whether this problem is there, and more importantly, to select couples who will be benefited by the immunological treatment. Now, a brief about the immunological treatment that we give based on these 5 investigations. We give a treatment called as our patented branded treatment of Immulit, which is a special type of lymphocyte immunization therapy, which is the way we do it. It's a one-time 3-hour process, and where we collect husband's blood, and in certain cases when husband is not able to give blood for any particular reason, then from a donor who has been tested, donor's blood is collected and it is processed to separate lymphocytes by our patented process, and a particular concentration of these lymphocytes are then injected into the skin of wife, and these cells have special ability to stimulate mother's immune system to start the process of protective antibody formation, as well as increasing the level of the T regulatory cells. Together, the protective antibodies and T regulatory cells help protect pregnancy, thus preventing subsequent recurrent reproductive failure, be it a miscarriage, be it an IVF failure, or even unexplained infertility. So there are, apart from these investigations, there are many other investigations which are otherwise recommended. There is one important issue I can mention is the T regulatory cell estimation. Now this test is relatively costly, it's quite costly, and as a routine to do this test is sometimes not possible, so it is not included in our regular test. But abroad, T regulatory cell estimation is done as a to find out the immunological problem and the response to the immunological treatment, so that accordingly treatment can be planned. Here, one more thing I want to insist, that the Immunology treatment or the active immunomodulatory treatment is the most effective part of the treatment, because it corrects the basic immunological imbalance. And to select couples for this specific treatment, the investigations which I mentioned are beneficial. So these are the investigations which will help select couples. And after that, the immunological treatment is combined with certain immunomodulatory medications to enhance the success of the Immunology treatment. And together, the Immunology treatment and the medications help in proper conception and subsequent growth of pregnancy. So far, I have talked about the investigations that we specifically do. Along with that, there are certain investigations which also impact the immunological process of implantation and early growth of pregnancy, which also form a part of our list of investigations. And these include lipid profile, HbA1c, homocysteine. So lipid profile, deranged lipid profile also has an impact on implantation by affecting the conversion of M1 to M2 macrophages, which is required for conducive environment in the endometrium, the anti-inflammatory environment. And if their cholesterol or triglycerides are high, this M1 to M2 macrophage conversion is not possible, leading to reproductive failures. Even high HbA1c or PCOS, which is associated with insulin resistance, can impact the implantation process, immunological implantation process. So therefore, correction of this is also important with medications. So that is again forms a part of our investigation. Homocysteine, high homocysteine is a marker for inflammatory environment, and that also is an important associated investigation. So these investigations together help in selecting couples who have allo-immune problem and help us to take practical steps in treating these patients by the required immunological treatments in the form of Imulit, which is an active immunomodulatory treatment, and the passive immunomodulatory medications. So I won't like to go I don't want to go into the details of all other investigations. There are certain sets of investigations which are practiced in certain centers, which are mainly related to the genetic part, genetic investigations, and they are predictive of certain immunological problem, but many a times they are not actionable. And so because finally genes act through certain mechanisms, so genes don't directly produce action. So genes either will act through antigen antibody reaction or through immune cells or immune cytokines. So these are the three part things, mechanisms which are important for the immunological investigations, and these are the tests that we recommend, which can help us to take action accordingly. So therefore, the investigations which I discussed are actionable because we do the antigen antibody, there's the protective antibodies, we do the immune cells, the natural killer cells, and the cytokines or the TNF alpha. So these three tests will help us to take action in these patients and help them have successful pregnancy subsequently by correcting the immunological imbalance and producing the protective antibodies and protective cells. So, if you have any queries, you can write here on the in the box, chat box, and I will answer these questions. Mm, One question is: do you repeat these tests after doing the treatment? So if you read about lymphocyte immunization therapy, there are it is many centers it is practiced as a two time therapy or four-time therapy. Certain tests are repeated, but the way we do it, our protocol is just one-time treatment followed by passive immunomodulatory medications. So we do not repeat any of these tests. If the TNF alpha is very high, yes, we recommend it to be done if patient is very anxious. But as I mentioned, the analogy of typhoid and the fever, the and once the immunological protection is in place, TNF alpha naturally comes down, NK cell activity becomes normal. So initial combination with passive immunomodulatory medications is sufficient, and we don't usually repeat these tests. So still, if you have any queries, you can always contact us on our helpline number 9833201522. You can visit our website www.icprm.in and definitely tell about these investigations, share these investigations with your colleagues, with your doctor friends, and if you have any queries, you can contact me anytime. And if you want me to cover many some other topics related to the reproductive immunology, do let me know. I will cover it in our subsequent live presentations so that there is more clarity on this little not so easy topic. So thank you very much for attending this live presentation, and I really enjoy this presentation with all of you because it helps us to clarify certain topics which are usually not able to discuss, say, in a video or in one-on-one session. So I think till thank you again for your presence for this presentation, and see you again in the next live presentation. Thanks a lot. Bye. Have a great night.